Thank you for joining us today for Supply Chain as the Hub to connect to your organization, Part 1, Getting Started. Today we are speaking with Dena Jackson of Providence St. Joseph and Sophie Rutherford of Jump Technologies. Providence St. Joseph and Jump Technologies partnered to identify available technology to improve internal logistics, bridge gaps in procure-to-pay processes, and most importantly, empower internal customers. Thank you both for being with us today. Our first question is, how does supply chain connect internal customers inside an organization?
One of the things that we often say about supply chain is one of the very few departments in a hospital that touches every single department. So we have the ability to reach out to those customers. Every one of those customers is looking for us to supply them with something that they need in order to run their business. So it becomes a task of making sure that we have the internal customers aligned so that we can deliver on our objectives, which traditionally is to make sure that we're maintaining quality within the organization, but also to reduce costs.
Perfect, thanks. What are some ways to build internal teams in order to create a more connected organization? Sophie?
The first place to start is, obviously determining what your initiative is, and then identifying those subject matter experts. Those subject matter experts are going to be the champions for your initiative. They're going to carry the message throughout the organization and help you identify those early wins. Those early wins are going to be critical and important to the process and to the success of the project. So identifying those subject matter experts early on, I think, is very, very crucial.
Great, thanks, Sophie. And how can you create a more collaborative partnership within your organization?
The partnerships are going to be based on aligning your goals. Your goals are going to be the driving force of those collaborative partnerships. And again, I think identifying those subject matter experts, having those early wins, and having equal wins, so it's a win for both sides of the partnership, I think are going to be some of the key things that you need to do for those partnerships.
Absolutely, and I think to tag on to that and talking about aligning goals, it traditionally we haven't had the same goal alignment. Supply chain's goals are traditionally very different. Obviously, everyone working in the health system wants to provide excellent care to the patients. But the goals of, a nurse running an operating room versus someone like me sitting in supply chain who's charged with removing costs from the system, sometimes our goals can be opposing, certainly not aligned. So there's a lot of work to be done there in order to get those get us on the same page and working towards the same end. Otherwise, you'll find yourself in constant conflict. So it's important to build those relationships with those clinical leaders and then work to come up with a set of goals that you're both working towards.
Thanks, Dena. And the last question, what are some types of technology or tools that we can look for to help create a supply chain hub?
Yeah, so I'll start with that one. I think traditionally we've always had obviously our ERP system. So whatever system you're using to run your supply chain, your financials, sometimes your HR systems, and then our EMR, which is our clinical systems. We are to the point now in most organizations where those two systems in some way or another can talk to each other. But what we have to do is create visibility into the data that we have in supply chain so that the end users have the ability to go in and look. So if we've sat in a room and had that conversation around aligning our goals and we have a project and we've identified our subject matter experts and everyone's going down the same road, we have to be able to measure that. And so we need to provide tools to those end users and those subject matter experts so that they have visibility. So we're not always, they can push a button versus us having to feed them information constantly. So we have a tool within our organization that has visibility at every one of our ministries where they can go in and look to see where are we on a project? What's the anticipated savings for my particular hospital? What are the milestones we're supposed to be hitting and have we hit them? So it doesn't have to be us sitting down in a room with that group. We actually can provide them access to that system and they can go in and do that themselves.
And I think what you mentioned about having enterprise-wide access to the data is key. Being a technology provider, I think that's one of the most important things, is not having that silos of information across the organization, having enterprise-wide visibility, having systems that allow you to scale for growth, because organizations right now are in merger and acquisition activity pretty heavily. So being able to onboard a new hospital into your system, having access to that new hospital's data right away is going to be very important in the future state of the IDN model.
Absolutely.
Thank you very much. Dena, would you like to give us any final thoughts?
Sure. So again, thank you for having us. I think that in summary, it's important as you're getting started that you identify who those internal customers are that you need to make sure that you have on your team, who are the subject matter experts that are going to help you move that project, and then ensuring that those goals are aligned and that you have support from your executive team. And then as you do, creating that visibility so that you can hold each other accountable to the goals that you agreed on.
Yeah, I think it goes back to, people, processes, and technology. As long as you have those three things in place, I think you'll see a lot more success in your goals and your projects.
Thank you very much, Dena and Sophie. We greatly appreciate your explanations. Join us for our next session on Supply Chain as the Hub to Connect to Your Organization, Part 2, Use Case.